and the ranking member should be here shortly. Good afternoon, everyone. And before we get on to our oversight hearing today, we will conduct a brief business meeting to approve an authorization and oversight plan for the 118th Congress. The text of the plan was sent to all the members last week. It lays out the comprehensive strategy to oversee the care and benefits being provided to our nation's veterans. Now, I thank the Ranking Member Takano for working with me to put together a joint document that lays out a great vision to complete our mission. Is there any discussion of the proposed oversight plan? Representative Takano. No? Okay. Okay, I now recognize Ms. Radewagen for a motion to approve the resolution adopting the proposed authorization and oversight plan for the 118th Congress.
Mr. Chairman, I move that the committee adopt the resolution adopting the authorization and oversight plan for the 118th Congress.
All those in favor say aye. Aye. All those opposed, no. In the opinion chair, the ayes have it. I ask unanimous consent that all members shall have 5 legislative days in which to revise and extend their remarks from today's business meeting. Hearing no objections, so ordered. This concludes today's business meeting. The meeting is adjourned. And get our witnesses to come forward. If we can have our witnesses come to the witness table, that'd be fine. Yeah. Good afternoon, and thank you all for being here. Welcome to the House Committee on Veterans Affairs' first oversight hearing of the 118th Congress. I'm honored to be the chairman of this important committee and leading a group of great members. Every one of these members, Republican and Democrat, is here because they believe in President Lincoln's promise. We all have the responsibility, every man and woman who has served in our armed forces, to craft laws that deliver veterans the care and benefits they've earned. This starts by overseeing VA to make sure that those laws are carried out as intended. Unfortunately, VA at times has fallen short of that promise to the veterans, and last year, Inspector General Michael Missel, who is here with us today, put it plainly. While discussing the tragic incidents of the VA medical centers in Arkansas and West Virginia, Mr. Missel stated these failures were the consequences of, quote, disengaged leadership and dangerous culture that is fostered when leaders are not attentive to or invested in their staff and the veterans they serve, end quote. Mr. Missel, those were powerful words. They ring in my ears. They echo in this room. And I hope they keep those failed leaders up at night. Sadly, there are not the only instances of failed leadership. Recently, we've seen veterans denied access to community care in direct defiance of the Mission Act guidelines, poor care coordination, and delayed diagnoses resulting in low-quality care for veterans, VA improperly rejecting 31,000 disability claims submitted through its own website, senior leaders ignoring disciplinary recommendations and failing to hold management accountable. The EHR modernization program is on its 4th director in 5 years and continues to burn money and distribute care and disrupt care, and the VA prioritizing employee productivity at the expense of veterans receiving compensation and pension benefits. Strong, engaged, and thoughtful leadership is the single most important factor needed to successfully run an organization of any size, be it a family-owned trucking company like the one I used to run, or one of the largest departments of the federal government. I am confident that every member of this committee agrees with me. All of the examples I just listed are areas where leadership failed. However, they are not the end of the story. We can and we must learn from these failures to deliver a VA that is worthy of veteran service to our great country. This is how we will drive VA towards success, like medical facilities, empowered employees to identify and address issues without fear of punishment, helping over 2 million veterans secure housing with a VA home loan over the last 2 years, saving over 200,000 veterans from having their houses foreclosed on during record high inflation caused by the Biden administration, and ensuring that veterans receive a dignified burial. There are all these successes that we can be proud of, but unfortunately, they're not yet the norm. VA is simply not where it should be. And bringing VA into the 21st century for veterans is my #1 priority. With engaged and accountable leadership on every level, VA can get to where our veterans need it to be. That starts today. We can get there with tough but fair oversight, common sense legislation, a commitment from VA leadership to always put veterans at the forefront of their decision-making process. And with that, I thank our witnesses for being here today. And I now recognize Ranking Member Takano for his opening comments.
Well, thank you, Mr. Chairman. You and I have served together on this committee for more than 8 years now. And while we may have our differences from time to time, and while there are certain issues on which we will never see eye to eye, one thing I have appreciated about working with you is that whenever possible, we have done our best to find common ground. I think one of the most fundamental things we agree on is our obligation to hold VA accountable for achieving its sacred mission of caring for and honoring our nation's veterans and their families, caregivers, and survivors. The last 4 years were busy and productive ones for this committee. We saw 36 bills enacted into law, including legislation that will address the effects of toxic exposure, improve veterans' mental health, and reduce suicide, strengthen delivery of health care and benefits to women veterans, support veterans experiencing housing insecurity, and strengthening VA's IT modernization efforts and cybersecurity. Dr. Elnahal, Mr. Frew, and Ms. Quinn, you hold a tremendous amount of responsibility. We know you and Secretary McDonough are facing many challenges as VA strives to meet its mission. One such challenge, a substantial one to be sure, will be implementing the Honoring Our Pact Act, a landmark legislation I championed that finally recognizes the effects of toxic exposure as a cost of war. Because of the PACT Act, more than 3.5 million veterans are newly eligible for VA health care and disability benefits, the most significant VA eligibility expansion in decades. And like the witnesses, this committee also holds a tremendous amount of responsibility. We must conduct rigorous oversight to ensure the department faithfully implements new legislation like the PACT Act, while also holding VA accountable for efficiently and effectively delivering all other health care and benefits veterans have earned. Fortunately, we have with us today two of our nation's foremost experts in accountability. VA's Inspector General, Mr. Michael Missel, and Controller General Gene Dodaro of the Government Accountability Office. Together, they bring to the witness table at least 80 years of collective experience in conducting independent, nonpartisan oversight and investigations. And as such, they will be able to speak extremely knowledgeably about what it takes to ensure accountability at VA, the extent to which the department is successfully meeting its mission, and what, if anything, Congress can do to support improved accountability across VA. It is clear from their testimony that both Inspector General Missel and Controller General Dodaro believe strong, stable leadership is the foundation upon which accountability is built. Having served on this committee since my first year in Congress, I could not agree more. Mr. Missel and Mr. Dodaro, Chairman Bost, and I have have all been in our current roles since the Obama administration and have witnessed numerous transition in VA leadership during our tenure. And I'm sure today's hearing will provide many opportunities for us to examine the negative effects of leadership instability on VA's programs. In addition, I anticipate today's hearing will also provide an opportunity to examine other major management challenges at VA, including persistent staffing shortages, antiquated information technology, and aging infrastructure, and the extent to which VA is equipped to address them. So I look forward to engaging with our witnesses this afternoon and to beginning the work ahead of our committee this Congress. So thank you, Chairman Boss, and I yield back.
Thank you, Ranking Member Takano. And we will now turn to our witnesses' testimony. Testifying before us today, we have the Honorable Michael Missel, Inspector General of the Department of Veterans Affairs, the Honorable Jean Dodo, Comptroller General of the United States, and the Honorable Sheriff Aldahar, Undersecretary for Health and VA. Now, he is joined by Mr. Michael Frew, Principal Deputy Undersecretary for Benefits at the VA, and the Honorable Matthew Quinn, Undersecretary for the Memorial Affairs at VA. Mr. Missel, you are recognized for 5 minutes.
Thank you. Chairman Boss, Ranking Member Takano, members of the committee, I appreciate the opportunity to discuss how the Office of Inspector General's work enhances VA's accountability. The OIG shares this committee's goal to conduct effective oversight of VA so that it can better serve our veterans, their families, and caregivers. Our dedicated staff is passionate about their work and committed to our mission of meaningful, independent oversight. In fiscal year 22, our office released more than 250 oversight publications with 894 recommendations to VA. We made over 230 arrests and more than 180 convictions. And we had a monetary impact of more than $4.5 billion in addition to the invaluable work of our healthcare inspectors that enhance patient care and safety. These efforts to improve benefits and services for veterans and their families would not be possible without the funding and support we receive from Congress. Our office appreciates the work VA does every day on behalf of veterans. We value the regular interactions that we have with Secretary McDonough and other senior leaders to discuss their concerns and priorities. We generally get very good cooperation from the department. In addition, we have a strong and collaborative relationship with Comptroller General Dodaro and his staff. We coordinate efforts with the GAO, which promotes more consequential oversight. Our oversight work has identified at least 5 principles that are foundational to accountability, and there are examples of each in my written testimony. They are, first, strong governance and clarity of roles and responsibilities. We have found tension between VA offices that have policy and oversight functions and leaders in the field who are not accountable to those offices. In other cases, staff do not understand their roles and responsibilities, or there is outdated or conflicting guidance. Second, adequate and qualified staffing to carry out those duties. VA faces high staff vacancy rates across its programs and operations, especially within VHA. These long-standing shortages make it challenging for VA to carry out its many programs and functions. Third, updated IT systems and effective business processes. VA is in the process of modernizing a number of significant systems that are critical to its operations. We have been proactively overseeing VA's implementation of these systems. This includes publishing 14 reports on the transformation of VA's electronic health record system alone. Fourth, effective quality assurance and monitoring to detect and resolve issues. VA often lacks controls that effectively and consistently ensure that quality standards are met. Breakdowns in routine monitoring and workarounds undermine efforts to ensure eligible veterans and their families receive timely services and benefits. And fifth, stable and effective leadership. Frequent turnover, vacancies, and long-term use of leaders in acting positions have significant negative consequences. Stable and dedicated leadership fosters open communication, collaboration, psychological safety, and responsibility among all staff. I would like to emphasize that OIG report findings and recommendations directed to a singular facility, system, or program are typically a roadmap to help prevent or correct similar problems. These problems are often undetected or unaddressed in other facilities or offices across VA. I hope that this committee will join me in encouraging leaders at every level of VA to review our work proactively to determine if findings and recommendations are applicable to their areas of responsibility. We recognize that VA is working to develop these foundations of accountability. We routinely observe personnel committed to providing the highest quality care, benefits, and services to veterans and their families despite obstacles. The OIG will continue to provide practical and meaningful recommendations to help VA remove these obstacles and to improve its programs and operations. Chairman Bost and members of the committee, this concludes my statement. I look forward to answering any questions that you may have.
Thank you, Mr. Missler. And Mr. Dodaro, you are now recognized for 5 minutes.
Good afternoon, Mr. Chairman, Representative Takano, Ranking Member, and members of the committee. I'm very pleased to be here today to talk about GAO's work regarding the Veterans Administration. The VA is filled with talented people dedicated to their noble mission of serving our veterans. However, they work in an unwieldy, highly decentralized organization where efforts to bring about positive change are extremely difficult to happen. In fact, many initiatives to make improvements result in little, if any, meaningful change within the department. As a result of observing this over a number of years, I added a number of VA areas to a list we keep for the Congress of what we consider to be high-risk programs and activities. These are programs where there's waste, mismanagement, or a need of broad-based transformation. So we've added veterans health care, the acquisition management area, and disability exams to this area. Now, in the healthcare area, there are a number of things we pointed out. First, there's a need for better standards and measures to ensure timely access of veterans to the care that they need. Also, in the mental health and behavioral health area, more analysis to provide services targeted to veterans in need of intensive medical health services could be improved, particularly for rural veterans. Also, efforts to integrate behavioral health care into primary health services, which is one of VA's strategies, has been hampered by a lack of staff shortages, and more attention needs to be put in that area. Also, oversight of long-term care facilities needs to be improved, both in the oversight of state nursing homes that VA provides funds to, as well as VA's own community living centers. There also needs to be greater attention to ensure there are enough providers in the networks to provide care, and also that ineligible providers are rooted out and not allowed to provide care in the system, and that employees really pass the background screening investigations that they must pass in order to ensure the care of veterans and protect our veterans. And also, as Mr. Missel mentioned, there's a need for much more disciplined management practices to ensure the effective implementation of the electronic healthcare record system. Now, in the acquisition management area, there needs to be better strategies to purchase medical and surgical supplies in a much more efficient manner than there has been. There needs to be attention to supply chain management, so not only what's purchased, but how it's managed to get to the right places at the right time, and also to make sure you have an adequate workforce in the acquisition area that's trained and competent to carry out their responsibilities to provide the support necessary to give medical care to our veterans. In the disability exams area, this is one of longstanding concerns. We're still using at the Veterans Department, medical criteria and earnings loss information based on a 1940s model. This needs to be improved. VA's been working on it. They're 8 years behind schedule, and while there have been studies, there haven't been improvements to the system. Also, there's a big backlog. There's about 80,000 cases from their legacy appeals process, which on average was taking 7 years to render an appeal. There's a 380,000 backlog in appeals under the new 5-option appeals process that they have. So as a result of these legacy issues, they're not as well positioned as I believe they need to be and could be in order to implement the PACT Act. Now, that's going to be a heavy lift for them, and they need to learn from some of these past areas where they're not applying best management practices to effectuate a good, efficient disability system that ensures timely processing of original claims as well as the appeals process going forward. So we are dedicated at GAO to working with the Inspector General, with the Veterans Department. I've noticed some improvement lately in our efforts to get agreement of what needs to be done with the department, so I see some glimmers of progress, but that's only the beginning, and there's a long way necessary to really bring about the type of change that our veterans deserve. So I'd be happy to answer questions at the appropriate point.
Thank you, Mr. Dodaro. Dr. Eldahar, you're recognized for 5 minutes.
Thank you, Mr. Chairman, Ranking Member Takano, members of the committee, for this opportunity to appear before you today to discuss the Department of Veterans Affairs and our accountability efforts. I'm joined today by my colleagues from the National Cemetery Administration, Mr. Matthew Quinn, Undersecretary for Memorial Affairs, and Mr. Michael Frew, Principal Deputy Undersecretary for Benefits. The three of us have had the pleasure to lead a workforce that goes above and beyond to serve our nation's veterans. Linda Nair, a licensed practical nurse in Lewistown, Montana, demonstrated that dedication when she traveled through 2 feet of snow to ensure veterans receive care during inclement weather recently. She doesn't believe she did anything special, but I believe that she demonstrates our employees' dedication at every level of the organization. I'm sure Mr. Quinn and Mr. Frew can provide similar examples of staff who go the extra mile for veterans. And I want to express gratitude for the PACT Act, the largest expansion of benefits and care to veterans in a generation, and the Consolidated Appropriations Act of 2023, which provided additional authorities and funding to advance our mission. VA is also grateful for the partnership with independent investigators that improve the way that we serve veterans. Our transparency and accountability efforts are significantly enhanced by the Government Accountability Office, Office of the Inspector General, Office of the Special Counsel, and accreditation organizations. Thus, I have made it a practice to meet regularly with OIG, and I have met directly with GAO officials like Mr. Dodaro and his healthcare team multiple times to proactively identify opportunities for improvement. As a high reliability organization, or HRO, our goal is to enhance the overall culture of safety and decrease patient harm events across the organization. The HRO accountability framework involves instituting a just culture, which balances individual accountability with systems thinking. Patient safety literature has shown that system vulnerabilities account for the vast majority of patient safety events and lapses in care. And it is incumbent upon staff and leadership alike to report and respond to systems issues. However, the framework also allows for individual culpability in cases of malfeasance, neglect, or instances where leaders fail to learn from or respond to patterns of problems when they arise. Accountability is also a culture and not a specific instance of wrongdoing. At VHA, our Healthcare Operations Center has established a system to track implementation of our priorities. Review of key performance indicators in every facility and VISN allow us to understand which regions are exceeding expectations, which have made significant improvements, and which could benefit from additional support to ensure every veteran receives the care they deserve, regardless of where they live. Recently, the Office of Accountability and Whistleblower Protection, or OAWP, has undertaken a significant outreach and education strategy that involves on-site visits by OAWP senior leaders and more widespread, tailored training. All three VA administrations have embraced these efforts and are working with OAWP to extend their reach. My colleague, Mr. Quinn, is ensuring that our national cemeteries are held to a standard befitting of a national shrine. Each year, cemetery directors conduct self-assessments of their cemeteries to ensure compliance with established standards. NCA teams also conduct meticulous on-site reviews of selected cemeteries, and sites are required to develop plans to address any areas noted for improvement. Recently, NCA achieved an index score of 97 on the American Customer Satisfaction Index, the highest score ever achieved by any organization, public or private. And my colleagues, Mr. Frew and Mr. Josh Jacobs, are ensuring that veterans receive appropriate and timely benefits. I'm proud to say, as their colleague, due to the efforts of dedicated VBA employees, VBA processed a record number of claims in fiscal years 2021 and 22, and we've already processed more claims so far in fiscal year 23 than we have at the same point last year. In addition to increasing total production, VBA employees also increased productivity in fiscal years 21 and 22, completing more rating claims per FTE than ever before. Further, of the more than 320,000 PACT Act-related claims received since the PACT Act was signed into law, nearly 140,000 claims have been processed and 1,500 terminally ill veterans have been granted presumptive service connection. VA continues to conduct compliance and quality reviews to ensure leaders are accountable for quickly and accurately providing veterans the benefits they have earned. The legacy appeals inventory has been reduced to just over 25,000 cases, representing a 92% reduction. Caring for our country's veterans and their families is a mission that unites us all, and I am honored to work with this committee, Congress as a whole, and our many other partners to embrace our collective responsibility to serve veterans. Chairman Boston and Ranking Member Takano, thank you for the opportunity to appear before you today, and we look forward to your questions.
Thank you, Dr. Aldenhall. We're going to now go to questions, and I would like to recognize myself first for 5 minutes. Dr. Aldenhall, on January 31st of this year, Dr. Miller Meeks and I sent a joint letter to you asking regarding data regarding abortion provided by the VA. Well, we requested that you would provide us that data by February 10th, 2023. However, my office is still waiting for your response. Can we get a commitment from you that we can get that response by March 3rd?
Chairman, we will certainly respond to the letter. We have to make sure that our response respects the safety and privacy of the
Right,
veterans we serve.
and believe me, in the letter, we weren't asking for names. We're asking for numbers. And so that's what we're asking for. And also with that, we're asking the procedures and at what point these were done. So no private information. We're not wanting any private information. We're looking at this as a whole. And also, we're needing to ask also if you could respond to the quarterly request for data starting on March 31st. Because we know there's pending suits over this. We're just wanting to know where we're at as far as your mission and the procedures that you're doing without names.
I understand, Mr. Chairman. We're committed to getting you a response to that letter.
All right, thank you. Also, I need to applaud the VHA for their efforts to create an environment where any employee can raise their hand and report a problem. We appreciate that. However, too often I hear from employees who have reported harassment and hostile work environments, but nothing happens. We're losing good employees because we aren't removing bad ones. How do we turn that around? That's for you, Doctor.
Mr. Chairman, I think the initiative that we're undertaking around high reliability speaks exactly to what you're asking about. We want every single employee in our healthcare system and beyond to understand that they have the right to raise a voice, and in fact that they should be encouraged to raise issues when they see them without fear of retaliation and in a manner that protects whistleblowers so that we can respond effectively to improve the system on behalf of veterans.
Yeah.
That is the core of the high reliability effort, which started years ago and is now in place at every single facility as of September of last year.
And I really do believe that you as an administration and the secretary are trying to do that. I do believe that there are certain administrators at different facilities that maybe don't encourage that as much. So we want to work with you to make sure that when we get those reports that we make sure that our employees understand we want them to come forward because it's about the veterans. It's not about the management of any one facility. Mr. Missel, you've been the Inspector General since 2016. Your statement about disengaged leadership is very powerful. Do you believe VA leadership is up to the task of running one of the largest departments in the federal government?
We have found that the very senior leadership at VA is very engaged, and they understand the importance of oversight. They work with us very closely. However, all levels of leadership need to be engaged to have the highest functioning operation. What we have found in our reports is that a root cause for many of the problems is due to some failure of leadership at some level. And getting back to your last question about what can be done, if VA doesn't hold people accountable for issues that they have, it's really hard to improve the culture, and it's really hard to improve leadership.
I understand. Mr. Frew, VBA is faced with a growing backlog of disability claims. How are you working to build trust with veterans that VA will decide their claim correctly the first time?
Excuse me? Yeah. We take our mission very seriously to provide benefits to veterans, to all veterans, and we don't want any veteran to wait to access the benefits they've earned. We've positioned ourselves in the last several years with a series of people, process, technology changes throughout our organization in terms of people hiring more people in the last several years, in terms of technology, providing more enabling technology so we can quickly gather information and reach a decision, whether it's for a compensation claim or an education claim or a certificate of eligibility for a loan guarantee, and through processes, trying to find a way to get feedback from our people to the people that design the processes to say, that's not working as well as we can. We've been changing dramatically over the last several years, and our results have shown that we've been able to increase our production and deliver more quickly, more benefits to more veterans more equitably than we ever have in the past before. So I hope veterans judge us by what they see through the service we deliver.
Thank you for those answers, and with that, I will yield back and now recognize the Ranking Member Takano.
Thank you, Mr. Chairman. Dr. Ellen Hall, House Republican leaders recently announced their intent to cap fiscal year 2024 discretionary spending at the fiscal year 2022 enacted level. For VA, this would mean a cut of at least $31 billion in funding for veterans' health care, because Congress approves funding levels for VA medical programs one fiscal year in advance. I expect this committee will have a much more robust discussion about this at our annual budget hearing later this spring, but since the topic of today's hearing is applying lessons learned to drive future success, please tell us what a $31 billion cut would mean for VA's future success.
Well, if that were to happen, Mr. Ranking Member, I would be deeply concerned about resourcing the health care needed, not only for our existing base of veterans, but for veterans who are expected to increase their reliance on health care within the VA, including the aging veterans already enrolled in VA health care, but also the veterans who are standing to benefit from the PACT Act, both new enrollees and veterans currently enrolled who stand to increase their priority group after they apply for additional benefits from VBA. And on top of that, we have a situation where we expect demand to grow significantly year to year. And so we need more funding and more support, not less, and I would be very concerned about resourcing the care needed for veterans.
Well, thank you. Thank you for that response. Beyond the fact that this would destroy your ability to prepare for the up to 3.5 million PACT Act eligible veterans to enter the VA healthcare system, and I mention that because I was Inspector General Missel just cited in one of his 5 concerns about the success of VA is the understaffing, the chronic understaffing. So VA is already chronically understaffed. Can you comment about what this $31 billion cut would mean for VA's ability to staff up just in the professional arena? There are professional providers, our medical providers, what this would mean to be able to staff up for the 3.5 million veterans we anticipate entering into the system?
I think it's a very good question, Mr. Ranking Member. Certainty, at least to the greatest extent possible, on funding in the out years is really important when it comes to the hiring mission. Of course, we need the funding to start paying for new employees now as we bring them on. We brought on a record of 18,500 additional employees within the healthcare system in the first quarter of this fiscal year. But if you ask our operational leaders in the field, as I do every time we meet in our governing board, about concerns they have for funding into the future, this is an FTE base that we hope continues into the out years. And the need to be able to pay these employees to meet the veteran mission will continue into the out years. So we do hope that we continue to see the generous funding that Congress has been able to provide VA.
Well, you know, what programs or operations could withstand a cut of this magnitude? Are there any at VHA?
I can't think of one, Mr. Ranking Member.
Thank you. Dr. Aldenhall, I'm sure you're aware the DEA proposed 2 rules relating to prescribing controlled substances via telemedicine. These rules are urgently needed because we are rapidly nearing the end of the COVID-19 public health emergency, which for almost 3 years now has waived requirements for patients to have in-person evaluations with their prescribers prior to receiving controlled substance prescriptions. So very quickly, I don't have much time, will VA commit to providing a bipartisan briefing for committee staff no later than this Friday so we can better understand the potential effect of this rule for our veterans?
We'll definitely brief you, Mr. Chairman, when it comes to the implication for veterans. I'm very pleased to see that DEA put this rule out. We were very concerned about the ability to initiate new prescriptions for controlled substances, which not only include pain medications like opioids, but also immunosuppressants, for example, critical medications for conditions that veterans commonly face. And so we do hope this rule comes into effect, of course, before the public health emergency ends, so that we do not see any lapses in care for veterans getting care through telehealth.
Yeah, well, thank you for that. We only have 30 days to comment on the rule, as you know. We are already hearing from some stakeholders that DEA's rules are still too strict and could present unnecessary barriers for patients who need these medications to treat pain, substance use disorder, and other mental health conditions. And you just mentioned immunosuppressants. It's not just about controlling opioids. We got to make sure that our patients in rural areas remain capable of being able to get these medications without undue burdens. I yield back, Mr. Chairman.
Thank you, Ranking Member, and I now recognize General Berkman for 5 minutes.
Thank you, Mr. Chairman. We'll get right to it, folks. Mr. Frew, I'd like to ask you about the current flaws in the VA accreditation system for agents who are assisting veterans in obtaining disability benefits. Under the current model, accredited agents cannot charge fees for assisting in an initial claim, but instead collect on the back pay after the process is complete. Do you agree that this creates a financial incentive for those accredited agents to drag out the process as long as possible instead of getting things right initially?
As I said before, I don't want any veteran to wait to receive their benefit, but in terms of accredited agents, agents are not allowed to charge a veteran for submission of a claim before a VA. They're able to charge for an appeal, but not for an initial claim.
So the agent benefits if there's an appeal.
We always recommend to veterans to look for...
So let me cut to the point here. I guess the goal is, when do the veterans benefit? Because we can talk about things like efficiency and effectiveness. You can be very efficient. You can answer 1,000 emails today. But what was the effectiveness to the, if you will, the end game, in this case, benefiting the veteran, if none of those emails resulted in a positive outcome for them? Remember, last time I checked, we are all on this earth on a timeline. It's God's timeline. It's not anybody else's. But the point is, a moment lost is lost forever. And I would suggest to you that when you think about the requirement in the mission statement and the culture at the VA, and I applaud all of you for doing what's right for the veterans, because they did what's right for our country through their service. But we need to understand that to delay outcomes for the wrong reason is then hurting the veterans in the long term. So I'll just, I could probably talk about that for a long time and give examples, but time is of the essence for any veteran. Dr. Alnahal, we continue to receive reports from veterans and providers alike that VHA referrals for community care are still taking excessive time to be approved and processed. Why is this? What is the agency doing to alleviate this and better adhere to Mission Act guidelines for providing veterans care as timely as possible? Remember, time is of the essence. Sir?
Thank you, General, for the question. It speaks to my priority around ensuring veterans the soonest and best care possible, including in the community. Frankly, the time it takes, on average, for our system to schedule appointments in the community, as you mentioned, is much too long. It's an average of about 28 days, from the time that a veteran knows they need an appointment to the time that they receive a confirmed appointment in the community. We have to reduce that time frame. That is why it is one of our true north metrics that we are monitoring across the system, facility by facility, visit by visit, and tracking over time to reward the high performers and top improvers in improving their processes, but also to recognize the folks that need help and have the system come to their assistance. We're also making sure that we look at new scheduling systems to assist our offices of community care across the system. In fact, we have a request for information for a commercial off-the-shelf solution that should help with scheduling. Finally, we are also introducing an initiative to have veterans schedule their own appointments as an option should they choose to do so, as we've seen in pilots across the country that it dramatically improves the time it takes for a veteran to receive a confirmed appointment, after which the veteran circles back to us so that we can ensure that care is coordinated. So I want to make sure this is an option available across the country, General.
Thank you, and I know my time is about to run out, but that's an example of giving the veterans control of their future outcomes, just like giving them control of who they can work with for disability claims, for getting care in the community, for anything. Enable the veterans, and they're gonna get into it, and the VA will be better. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Bergen. Ms. Brownlee, you're recognized for 5 minutes.
Thank you, Mr. Chairman. First, Dr. Alnahal, I just wanted to express my strong support for the interim final rule around reproductive health care and your department's efforts to ensure access to a full complement of health care. And I really want to compliment the team that you have put on. We've had several meetings with them to follow up, and I just appreciate your diligence on that, your team's diligence. And I just want to say for the record, abortion is health care, so thank you very much. This is a broad hearing, and I'm going to ask a broad question. So, Dr. Alnahal, what do you think VA is doing well with regards to serving women veterans? And I want to, this is a broad question, but I want to know what the answer is with regards throughout the entire enterprise. I'm not really interested in that, perfect pilot program that's out there that's doing really well, or a certain area that is just providing outstanding health care to our women. But, what is VA doing well with regards to serving women, and what do you think VA has the most opportunity for improvement?
Well, I share your prioritization, Congresswoman, of better serving women veterans every day in this organization, the fastest growing demographic of veterans by far, accounting for 30% of new enrollees in our healthcare system every year. And so we're seeing some positive signs, certainly with the capacity building we've been doing. We have women's health program coordinators now at every major medical center within the system. We have women's health mini residency programs to be able to train every primary care provider that we can in comprehensive women's health. Some of these providers have been seeing mostly men for many years. We want to make sure they have that updated education about how to treat women veterans with the full scope of care. And of course, we're working as hard as we can to hire more gynecologists and specialists on women's health. I think where we have some room to grow is the trust among women veterans, and that has everything to do with making sure our space is accommodating. We provide more and more dedicated entrances to women veterans in facilities. That's an infrastructure challenge, and making sure our programming across the board is meeting women veterans' needs.
Thank you for that. And just, just to follow up, I think with the Inspector General here, I know that one issue that he has pointed out are MST coordinators across the enterprise. And I guess, I should ask you or ask the Inspector General, what is it going to take to get the intention of an MST coordinator is to have a full-time MST coordinator in all of those areas where the demand is. I know that there can be some exceptions to that out in a rural area somewhere where they're just not servicing women veterans, so I get that. But what is it going to take to get to a full FTE MST coordinator throughout the VA? Is it going to require the fact that we mandate that so that the local medical centers don't have control over their resources with regards to deciding if it's going to be 1/10 of an FTE or 50% of an FTE, et cetera?
Well, certainly our reports on MST, we've got multiple reports on MST, certainly show that more can be done in this area. And I know we've had discussions with Dr. Elnahal and his staff about this. I think they recognize the need, and as you pointed out, it could very well just be a resource issue. But we agree that more attention needs to be given to this area. Hearings like this and the previous hearing that we had, I think, really shine the proper spotlight on it.
Thanks. And Dr. Elnahal, in the last Women's Veterans Task Force that we had a roundtable to look at the implementation of Deborah Sampson. And it was really pointed out to us by women veterans representing lots of different agencies and VSOs and, across the country as well, really stating that this issue around sexual harassment and assault within the VA is still problematic, that it is implemented in some places and not in others, and it's slow-moving, and that they cited examples of women being really re-traumatized for reporting these incidences and coming to the VA to report them. So I will just say I don't have any time left, but we've got to be vigilant across the entire enterprise to make sure that if any woman walks into the VA, that they will be free from any kind of harassment or sexual assault. Thank you, Mr. Chairman. I yield back.
Thank you, Ms. Brownlee. Mr. Franklin, you are recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Frew, my first question would be for you. In the last Congress, I served on the Oversight and Reform Committee, and part of that oversight involved the National Personnel Records Center. One of the big concerns we had at that time was with those employees working remotely and so many of the medical records not being digitized, we had a huge backlog of veterans unable to verify eligibility for VA benefits and that sort of thing. Wondering what the impact is currently on you, what's the backlog, and what do you see coming down the pike, and how can we fix that problem faster?
The backlog today is just over 200,000, 201,000 out of 750,000 claims. It's about 26%, which is a fairly standard amount. In terms of National Personnel Records Center, that's actually a very good story where NARA personnel came to us for vaccination through VHA several years ago, and we placed 3 different shifts of VBA personnel in the Personnel Records Center so that we could pull files after the first few months of the pandemic that led to a backlog in their records retrieval, which hurt us in terms of operations. Within a few months, we returned to 2 to 3 day responsiveness in retrieving records from the NPRC. So I would say that's no longer an impact in our operations. What we see now is an impact in the number of claims that are ready for decision, where they were in gather evidence mode before. Now we see a lot more claims in the ready for decision, which is the last stage before we complete a claim. So the production of records from NPRC is no longer an issue. We're actually scanning every PACT veteran's records in the NPRC and eventually every veteran's records, living and dead. So when someone files a claim, they won't have to wait a second to get access to, for us to get access to their information. And we provide those files to NPRC or NARA so they can access them as well to deliver to their customers.
I have a company in my district, a private company that's been contracted to digitize those, but what I don't know, I'm not sure the timeline. When do you anticipate all those records being fully digitized?
Well, we're talking about 46 million or so records. That will be many, many years. The PACT records, the veterans that we believe fall in the PACT cohort, I think it's about 1.5 years is when we expect to have all of them digitized.
Thank you. Dr. Elnahal, as a greater veteran population continues to age, the importance of non-institutional or home and community-based services becomes more important. What are you all doing to ensure that veterans get the care and support that they need, whether it's through the VA or the community, especially for veterans living in rural areas?
It's a big priority for us, Congressman, especially as we see the veteran population aging and more in need of home-based care where we can. We, in fact, have an initiative called the Aging in Place initiative to see the full scope of options available to vets and to extend all of them where we can. We, of course, have our community care-based home services. We also have our caregiver support program, which we are investing in more and more, and we're reevaluating our eligibility criteria for that while we have a 3-year moratorium on legacy participants in the caregiver support program, particularly the PCAC program. And then finally, we are expanding the Veteran-Directed Care Initiative to every single facility within 2 years, which is an acceleration of the original 5-year timeframe, because we know that so many veterans have been able to benefit from this by basically asking a loved one or someone close to them to be their caregiver and allow them to have that financial support. So we are pushing hard on expanding that capacity, and we share your prioritization of this important issue.
Very good. Thank you. Mr. Chairman, I yield back.
Thank you, Mr. Franklin. Mr. Levin, you are recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Frew, I appreciate that VA's testimony addressed the Veterans Rapid Retraining Assistance Program, or VRAP program, which was established to help retrain veterans who were unemployed due to the pandemic. You may remember I was pretty vocal last year about using as much of the $386 million appropriated for the program to benefit veterans before the program expired. And in early September of 2022, which was 16 months into the program, VA had only allocated around 56% of the funds. So I was surprised, pleasantly surprised, that VA was ultimately able to obligate 98% of these funds by mid-December. So my question for you, Mr. Frew, is how was VA able to drastically accelerate veteran participation in the span of 3 months?
I think a lot of that went to consummate awareness, and not that you use the word advertising in the traditional sense, but getting the word out to veterans and getting the word out to schools. Because 2 of the issues we had with VRAP were supply and demand. The number of programs that were willing to say, I want to operate under this payment structure of VRAP was hard to get off the ground at the beginning, but by the end we had 1,300 programs enrolled in the VRAP program. And then awareness to veterans, because the restriction on who's eligible to be certified for enrollment were you had to be unemployed due to a COVID-related circumstance and have not received any federal or state aid and not have any remaining VRE or education entitlement. It made it difficult at first to get the wheels rolling, but as we got the word out, as people started to go through the programs, we got a lot more. I think eventually we had 30,000 applicants almost for the program, of which 4,300 graduated through the program, and we're very happy that we got more through.
That's a good segue to my next question, which is about the data. And I understand that the data on all the outcomes isn't available, as lots of veterans are still enrolled in programs or within the 180-day mark for certifying employment. But we do have some data. And to the best of my knowledge, as of January 3rd, VA had verified that 818 veterans who participated in VRAP had secured employment. By comparison, 2,744 veterans had not secured employment. So, Mr. Fruta, to what factors does VBA attribute this relatively low success rate, and what is VA doing to improve outcomes for veterans who are still participating in VRAP?
Well, one, we have a lot of experience in VRE in terms of working with employers and future employers. And the Vet Tech program is a good analog to this in a different sector, in STEM-related or cyber-related things. But we have an employer consortium in that area, which we work with to find suitable employment as quickly as we can afterwards. One of the tenets of VRAP that I like, that I think we're starting to see some benefit from, is the payment to the program upon employment. So programs are getting better at recruiting for their students. As of now, we're at, I think, 1,000 employed. So we've gone up a few hundred in the last several weeks. And we'll see as we get through the next 4 to 6 months after more of the people in the program complete the program. But I think a lot of it is relying upon the programs themselves to push for a positive outcome at the end.
And what are any other important lessons that you might have learned as a result of this program? And specifically, how will you incorporate the lessons that you've learned in similar programs in coming months and years?
I think the pay for performance is a nice feature of it, from the terms of make sure people don't just go through the program, or programs just don't apply to get federal aid without any positive outcomes at the end. So I think that feature is something that was a deterrent at the beginning, but as we worked our way through it, we got a lot more programs involved. I think starting earlier, getting the word out a whole lot earlier, would have enabled us to get more programs involved earlier, which would, of course, then enable more enrollment by veterans in those different programs.
And Mr. Missel and Mr. Dodaro, do you have anything you'd like to add to anything that's been said?
No, I mean, we've looked just very broadly at that program, but not in any detail. Obviously, we looked very closely at all the VBA programs to see whether or not we should be doing projects in them, and we're always open to looking even more.
Yeah, I don't have anything to add.
Well, I'm out of time, but I would just hope that the next time we stand up a program, that it doesn't take so long to really get things rolling, and that you've hopefully learned some lessons from that initial year where very little was happening. And I'm sure we'll be talking about it, although I hope it's nothing like a pandemic or anything like that. I know we'll be having new programs in the years to come. So I appreciate the work you're doing, and I'll yield back.
Hey, Mr. Levin, Mr. Rosendale, you're recognized for 5 minutes.
Thank you so much, Mr. Chair. General Quinn, it is so good to see you.
Good seeing you.
Dr. Elnahal, I've got a couple of questions for you. On September the 9th, 2022, the VA published an interim final rule titled Reproductive Health Services to immediately amend its regulations to remove the exclusions on abortion and abortion counseling. As you well know, I was deeply disturbed by that. I was proud to co-sponsor a resolution of disapproval being led by Congressman Cloud and Chairman Bost. This rule is in clear violation of Section 106 of the Veterans Health Care Act of 1992, which restricts abortions. The administration's explicit decision to violate the law is a slap in the face to Congress and the separation of powers. Specifically, the rule would direct the VA to provide abortions when health of the mother would be endangered. This rule also directs the VA to provide abortion counseling. While you and I may disagree on this issue, the taxpayers deserve to know how their dollars are being spent. With that being said, how many abortions has the VA provided since September of 2022?
So, Congressman, I appreciate the question. It is actually a number that is small enough to possibly allow for triangulation and identification of veterans and clinicians involved. So I think in this public forum, it would be quite risky to communicate that information, but we're happy to work with you, and of course the chairman's letter response will be important in getting feedback back to this committee.
We certainly want to make sure that we do get that information. How many dollars has the VA spent providing abortions since 2022?
What I can say, Congressman, is that we projected in the impact analysis of the interim final rule that we're talking about less than 1,000 veterans per year based on how we restricted the ultimate abortion service latitude in cases of the life of the veteran, the health of the veteran, rape, and incest. And it was really, the impetus was around veteran safety in the wake of the Supreme Court decision that no longer made abortion a constitutional.
Dr. Ellenhall, I understand our differences of opinion and what may or may not happen, and the definition that, which provides for this to be allowable. What is the dollar amount spent providing these abortions?
So all of that is to say that the number of veterans is quite small, and so the dollar amount is, compared to, of course, our total appropriation, very small number.
So I see you won't answer the first two questions. How many veterans have received abortion counseling since September of 2022? Can we answer that one?
For the same reasons I mentioned before, Congressman, with all due respect, I think we'd have to look at the implications of veteran safety before communicating that in a public forum.
Okay, well, we will look forward to getting that information in a more private setting. Even more egregious, there are no conscious protections for VA medical staff. A VA nurse practitioner, Army veteran Stephanie Carter, asked the VA for religious accommodations, but allegedly was told by the department that there is no process that exists to review such requests. The department says that it does allow employees to opt out of providing certain services based on their religious beliefs. Yes or no? Can the VA medical employee opt out of providing abortions or abortion care?
Yes, Congressman. In fact, we've made that policy clear very shortly after the release of the interim final rule through an all-employee message. And as of earlier this year, we put out specific, clear guidance on how staff and physicians alike can opt out of doing this, these types of services. We want to respect points of view on this and personal values and religious beliefs. That is a core principle that we are following.
Thank you. I would like to see that actually placed into the rule to avoid any confusion, if we could make sure that that happens as we go forward. I want to jump to another subject real quick. I'm glad to see, literally, everyone here in the room today with no facial coverings. We can actually see what you look like. I wrote the VA a letter last week regarding a veteran who contacted my office in regards to being denied service at a Montana VA clinic for refusing to wear a mask. It's outrageous to deny anyone, particularly a veteran, medical care over a personal decision. The Biden administration announced that the public health and national emergencies would terminate on May the 11th, 2023. While the date is very arbitrary, even the president recognizes he can no longer hold the public hostage with these executive powers. Do you support denying veterans care over their unwillingness to wear a mask?
Well, Congressman, I will say that we have looked at this recently as the pandemic has evolved into a much better place. And just as of this week, we have made the maximal, we have taken the opportunity to maximally relax the masking restrictions in our facilities according to CDC guidelines based on transmission levels locally. And so we are bound to follow CDC guidelines. We think it's important to be consistent with those guidelines, but we're trying to be as open as possible to veteran and clinician and staff preferences alike on this.
So when do you anticipate lifting these masking requirements?
Well, again, Congressman, we work with the CDC on this. We not only follow their guidelines, we partner with them regularly. And as the pandemic evolves, we'll see what comes next.
Thank you, Mr. Chair. I yield back.
Thank you, Mr. Rosendale. Mr. Pappas, you are recognized for 5 minutes.
Thanks very much, Mr. Chairman. I want to direct my first question to Mr. Frew. There's been a little bit of a conversation here about claims backlogs, and I just want to draw your attention to one specific issue. The committee has received several inquiries regarding delays in processing aid and attendance pension claims, and I'm wondering if you can shed any light on those backlogs and what steps are being taken to address it.
It's almost like I'm on my computer. So aid and attendance backlog, there is a slight backlog in aid and attendance. There's several thousand claims in there now. I actually have numbers here, which probably easier if I get to you there. But our average days to complete aid and attendance is hovering around 110 days, I think, now. And the reasons for backlogs are varied. You know, in the claims portfolio, it's because of the large volume of claims and the lack of ability to produce documents back in time. In aid and attendance, it's a smaller volume of work, but in a commensurately smaller organization. So I don't know how large the backlog is. I'd be happy to dig into that with you further, but anything we can do. As I said before, I don't want any veteran to wait for a benefit or any
That's helpful.
beneficiary.
Maybe we can dig into the specific issues that we've been hearing about and see if there's anything that's materially changed around that, and just see what attention can be drawn to it. I'm wondering if you could answer an additional question. Last Congress, the Disability Assistance and Memorial Affairs Subcommittee, of which I'm now the ranking member, had a hearing regarding VA's outreach to survivors and dependents. I think everyone was surprised at the lack of personnel and resources that has been dedicated to important tasks, including the proactive communication with new survivors. So I'm wondering if you can talk about what action has been taken since that hearing to bolster outreach, and any steps that have been taken to address this issue for survivors and dependents, and make them aware of benefits that are available through VA.
Yeah, awareness is one of the most key elements of enabling veterans to access their benefits. And for survivors, we have an Office of Survivor Assistance that's within VBA, but it's for the entire department. We also have an Office of Outreach, and the Office of Outreach and the Office of Survivor Assistance work together with Public and Intergovernmental Affairs and others to get word out. For example, with the new PACT Act, we reached out to every former DIC applicant who was denied to say, please apply again. There's new rules. There's a new legislation you might be able to apply for. We work with the branches of the military casualty assistance officers, and we work through county VSOs, state VSOs, and big national VSOs to amplify our message to eventually get to the people who need the information. I can say, as a son of a deceased veteran whose mother, my mother, did not know about benefits she was eligible for, I hated not knowing what was eligible for her, and I worked at VA. I'm more educated now in the benefits, and I want to make sure that there's no survivors like my mother that are unaware of the benefits that can help them with their lives.
Well, thank you for that commitment. And one final question for you. Last year, the department announced that it's closing a gap in survivor benefits for certain LGBTQ+ veterans, specifically those who are unable to get married before the 2015 Obergefell decision. So I'm wondering if you can provide a status update on VA's benefits for these same-sex surviving spouses, and how many survivors have applied for benefits through VA so far.
That's something I'll definitely have to talk to you offline. I don't have the numbers on veterans who have applied for those benefits, but our goal for that was to act as if those survivors were in the same, if they were in a state that didn't allow a marriage between a same-sex couple, we wanted them to have access to the same benefits as if they were. So the opening of that was geared around equity to veterans in different groups. The numbers I'll have to work with you offline for.
Okay, thank you. We'll follow up on that. I yield back, Mr. Chair.
Thank you. I now recognize Representative Van Orden for 5 minutes.
Thank you, Mr. Chairman. Thank you all for coming here today. I appreciate it greatly. I'm a 100% service-connected disabled veteran, and I get all of my health care through the VA. I want to share with you and preface this my comments, that the vast majority of my experiences at the VA have been overwhelmingly positive, and I'm very grateful for the staff throughout Western Wisconsin, including La Crosse and the Medical Center in Tomah. I'm very proud of them. However, we can all do better. That's what we do as Americans. We continuously seek improvement. And in that spirit, Dr. Elna Hall, I want to share with you how I spent my first day in Congress. I got sworn in, and I received an email, and I'm going to read it to you right now. So my wife and I tonight attended my brother's visitation, and I'll be attending tomorrow his funeral. He passed away on Wednesday before Thanksgiving. He's a Wisconsin-born, recently retired from the Army after 22 years. Currently residing in North Carolina. He leaves behind a beautiful wife and 3 beautiful young children. He went to the VA for help for mental health issues and was turned away. He took his life the Wednesday before Thanksgiving, and 2 days later, a letter from the VA came in the mail accepting him. It's too late. His name is retired Major. I won't read that publicly. It should be illegal for the VA to refuse a soldier who is retired or active duty trying to get help from getting admitted. I'm requesting for you to work with your counterparts in North Carolina on some kind of legislation to prevent this from happening to another soldier or veteran again. I spent my first day as a United States Congressman calling the brother of this dead soldier, calling the father of this dead soldier, calling the widow of this dead soldier, and apologizing profusely for the federal government's inability to schedule a medical appointment. It sits on my desk with this sticky pad, and it said, "This is why I'm here." And I know you've got a tough job, and I know that sometimes we can be distracted by the events, especially when you're leading a huge bureaucracy like the VA. So I prepared this for you. Bring that to him, please. Will you bring that to the doctor? This is a copy of this letter, sir. You can put that on your desk, or you can hang that on your wall. There's a blank sticky pad there. And I think it would do us all well if you wrote on there why you're here, and to never forget that. So things are going to be dark some days. People are going to get on you. I understand that. But every day when you wake up in the morning, me and my fellow millions of veterans throughout the United States of America would be deeply grateful for you if you remember why you're here. And with that, I yield back.
Shifless McCormick is, Congresswoman Shifless McCormick, you're recognized. I'm sorry.
Thank you, Mr. Chair. My first question is for Mr. Dodaro. In 2008, the National Defense Authorization Act directed VA and the DoD to develop and implement systems that would allow for interoperable electronic patient healthcare information exchange between the department. After numerous starts, stops, and failure attempts, that requirement has not been achieved. Now, both departments are working in deploying Cerner Corporation's EHR platform across the respective healthcare systems. Mr. Dodaro, does GAO have an estimate of the VA's expenditures on failed EHR modernization efforts before the current Cerner EHR project? We are very concerned that the total cost for the EHRM project remains to be seen, and it would be helpful for the committee to know the running total for taxpayer spending on past EHR modernization efforts.
The cost that we estimate is over $1.7 billion for failed predecessor electronic healthcare record systems that either failed or did not come to fruition.
Thank you so much. My next question is for Dr. Enninghall. Dr. Enninghall, the EHRM program is in the midst of another pause, presumably to address some of the system's longstanding technical and design issues. What has your office's participation been in this evaluation, and do you think this pause is going to positively impact the direction of the program? If so, how?
Well, Congresswoman, that was the exact intent of doing the pause. We called it the assess and address period because that's exactly what we've been engaged in diligently since we announced it. We're looking specifically at the system configuration issues, but also people and process matters that led to our need to disclose to tens of thousands of veterans that their care may have been delayed or affected by the implementation of this system. And we took that responsibility very seriously. In the coming weeks, we're going to be releasing the results of that work to include not only Oracle Cerner's responsibility to fix the configuration of the system, but also our own in making sure our people and process matters continue to improve. But we're very dedicated to that.
Thank you. My last question for you. The total number of veterans enrolled in the VA's health system increased from 7.9 million in 2006 to about 9.2 million in 2022. This increase in beneficiaries needs to be matched with an increase in providers to meet the need of every veteran. What steps has the VA taken to ensure that there are enough health care providers to care for our veterans and ensure that the veterans of color receive cultural competence and trusted care from providers that look like them and understand their health care needs?
I absolutely agree, Congresswoman. It's why the first and most important priority that I've set for the healthcare system is hiring faster and more competitively. We absolutely need to be staffing our hospitals and clinics, but also our support personnel to the greatest extent possible, not only to serve our existing base of veterans, but to, for example, meet the need of all the new enrollees we expect to see from the PACT Act. So that includes the staff that you're talking about, and we've already hired more than 18,500 staff in the first quarter of this year. We've also seen a higher retention rate compared to January of last year when we had a 4% loss rate. We only had a 2% loss rate just last month. And so the combination of greater retention and greater hiring has led to 388,000 employees on board. That's an end strength that we think will continue to get better throughout the year because of our attempts to improve hiring.
Thank you so much. My next question is for Inspector General Missel. One of the final hearings the committee held while Democrats were still in the majority in December of 2022 was an oversight hearing on the VA's progress in implementing the PACT Act. This hearing provides a significant opportunity to get updates on the VA's progress meeting major milestones outlined in the law. VA has processed PACT Act claims on January 1st, 2023, according to the data committee received from the VA this week since the law's enactment in August of 2022. More than 309,000 veterans have and survivors have submitted PACT Act-related claims. In your role as the Inspector General, what oversight do you have in processing the PACT Act claims? And how can we ensure veterans are having a streamlined process while awaiting confirmation of benefits?
Well, as previously noted, the PACT Act was one of the most significant increases in VA benefits in its history. We recognize the importance of it. They're just starting to process those claims at this point, but we've already put together a team of people to address it from a number of different areas, including the people, the staff that they're needing to hire, the processes, how they're processing the claims, and the technology, what they're doing along technology lines as well. So we expect to have a vibrant oversight just given the importance and the amount of money at issue.
Thank you so much for your responses. Mr. Chairman, I yield back.
Thank you. The lady yields back. Representative Ciscomani, you're recognized for 5 minutes.
Thank you, Mr. Chair. I serve a community in southern Arizona in the Tucson area where the VA hospital there serves 2 military bases, DM Air Force Base and Fort Huachuca Army Base in Sierra Vista. And therefore, I serve a large veteran community, and I do hear constant good feedback and a lot of improvement, and specifically the VA hospital. I, like my good friend, Congressman Van Orden, also believe that there's room for improvement like in anything. So my question is also in the same vein as my colleague. So Dr. Elnahal, Chairman Bowe sent a letter to the Secretary weeks ago asking the agency to expand on its methodology for counting veteran suicide deaths. An issue that concerns me is that a large number of these deaths are ruled accidental or undetermined by our coroners, and as opposed to suicide or homicide. So many of these undetermined veteran deaths are drug overdose deaths as well. Does the VA have any intention of examining these deaths due to overdose or risky behavior within the context of suicide prevention? Could the VA include this type of data in its suicide report? This is a real issue that we see on the rise more and more, unfortunately, among our veteran population, and one that I hear from my community constant, and specifically after this example from the congressman, I think it deserves weighted attention on this.
I agree, Congressman, and we are always open to feedback and input about how we calculate veteran suicide information every year. We work with the CDC closely on this, medical examiners across the country. Our methodology is published online. I want to say that we are not only focused on veteran suicide, which is my top clinical priority and has been for the agency for years, but also the various different inputs into deaths that some folks may be trying to categorize or are giving us feedback saying that we should categorize or consider doing so for suicide. So for example, substance use disorder, we have extensive programming to include residential treatment, medication-assisted treatment, and various programming for veterans suffering from that. Also, the broad scope of our mental health care services continue to expand. We're doing more telemental health care than we've ever done before. We have more than 17,000 providers across the system providing these services. And so we are, of course, dedicated to expanding that capacity as much as possible. And to Congressman Van Orden's request of me, I will keep this on my desk, and I will always remember that story. And I will make sure that we continue to try and do better and better to prevent this scourge and to deal with this pressing public health issue.
Thank you. I yield back.
Mr. McGarvey, you are recognized for 5 minutes.
Thank you, Mr. Chairman. I appreciate it. Thank you, gentlemen, for being here today. I echo the comments of some of my colleagues, Mr. Scamini, Mr. Van Orden. I also suggest that cutting $31 billion in the VA budget is not the way to best address some of those problems in the next year. I want to switch to something going on in my district specifically. In August of 2022, the VA OIG issued a report about issues with Camp Lejeune processing, the claims processing, a topic of which I hear about a lot from my veterans at home. So, Mr. Missel, this one's going to be for you. And it was in a report that the VA OIG recommended that the VBA consider centralizing all Camp Lejeune related processing claims in the VBA's Louisville regional office. As you're likely aware, compared to other regional offices, the Louisville regional office actually had a much lower error rate. They processed a lot of claims. They only had an 8% error rate, and that is compared to a 40% error rate of all the other offices combined. So 40% for all the others, 8% for Louisville. And in response to those recommendations, the VBA said it would assess all of the regional offices' accuracy of processing Camp Lejeune-related claims over time, and if the accuracy has not shown consistent improvement, that VBA would consider further centralization. So my question is, what progress has the VBA made on determining the need for centralizing the processing of Camp Lejeune claims since the report was published?
So as you correctly pointed out, there were significant problems with the processing of the Camp Lejeune claims. We projected out of the 37,000 during a 4-year period, 21,000 were not processed properly. 17,000 of those 21,000 were prematurely denied because they didn't have enough information. One of our recommendations involved the centralization of the claims. My understanding is that VBA is going to centralize it, but before we close out that recommendation, we want to see that it's actually done and how it's working. And then there's a second recommendation from that report that remains open as well.
I appreciate that, because it does seem like there's some hesitancy in moving forward with that recommendation on centralization. And so I guess for maybe Mr. Frew, what I would say is we do have spaces in the VA that deal with this already. We have teams at VBA that currently specialize in processing certain types of claims, such as military sexual assault trauma. So why is there a hesitancy in going ahead and centralizing those claims in the Louisville office?
I would say that the issue with specialization versus generalization is there's a lot of different disabilities, and there's a finite capacity to centralize into different areas. So it's not a lack of desire to get better. It's not a lack of desire to find that the answer of centralization will answer this, because if we did that with all of the disabilities, we would run out of offices to do the centralization. So our goal, and what I consider a quality organization, is a veteran that applies from any state, through any modality, through any external help, whether it's a VSO, accredited representative, or us, has access to the same outcome. And centralizing makes that more likely because you're looking at one place to enforce outcomes. But we do have a distributed workforce, and we do a lot of work around the nation, and our goal is to make that as high quality as we possibly can across the nation.
Well, and, you know, I'm not saying centralization is necessarily the answer. I think the numbers that Mr. Missel gave illustrate the real problem, that potentially tens of thousands of Camp Lejeune-related disability claims have been subject to processing errors. And so the most important thing here are the men and women who served who are not potentially getting the care, the treatment, the resources they need. So, Mr. Frew, what is the VBA doing to proactively identify those claims that were processed incorrectly, to notify the veterans of the error, and to allow them to update their claims accordingly?
I'd have to go back to the report. It's the last time I looked at it was a few months ago. But when we got the identification of claims that the IG said were processed in error, we did reach out to everyone. We did relook at every single claim, and when we found a claim that we did find an erroneous answer, so some that were processed in error that were prematurely decided, when we looked at them again, they came to the same conclusion. The answer was still the same answer that we got before. So when we get to a claim that we re-adjudicate and we get a different answer, then we reach out to that veteran and reopen the claim and work with them to the ultimate conclusion.
I'm out of time, so I yield back.
Thank you. Representative Self, you're recognized for 5 minutes.
Thank you, Mr. Chairman. My issue is the director of the Dallas VA Center. You are free to select your senior leadership any way you will. I believe that you have damaged your relationship with your stakeholders. The Dallas VA Center is not in my district, but the Metroplex is a large place, and that VA Center is the second largest in the country, I understand. You're free to select your director, but the deputy was not considered for the job. Highly qualified. He'd been the deputy for the second largest center in the nation for a number of years. The man that was selected to be the director came from a very small center, and the deputy was not considered at all. So if I go through the others, Central Texas conducted a full and open interview process. Amarillo was full and open. El Paso was full and open. You didn't even post the position in the second largest center in the nation. And again, I believe that you have damaged your relationship with the stakeholders, with the veterans in the area. Believe you me, there are a lot of veterans in the Dallas Metroplex and in North Texas. So my questions are, did Mr. Jones, is it Dr. Jones, the HR director, Mr. Jones, Dr. Jones? Your HR director, did he follow proper protocol when considering the new executive director of the North Texas Dallas VA? Then the real question I have is, does it make sense that he would select a candidate from a clinic of 17,000, move him to the second largest in the country with a budget of roughly $20 billion?
So, Congressman, I had a chance to visit the Dallas VA Medical Center, met the individuals that you're talking about. Wendell Jones is the network director across Vision 17 for Texas. I think it's an extraordinary asset for the veterans and the community. Personnel decisions are always very difficult. Before I signed off on this action, I checked with our Office of General Counsel, and they determined that the process was within the scope of the law. But what I can tell you is we have a commitment to ensuring that the entire team there is supported to meet the mission on behalf of veterans in the Dallas area.
So in your mind, you signed off of it. You just gave me a legal process. How about the personnel process? Did you hire the best man for the job or woman for the job? We're not discussing names here. Did you hire the best person for the job?
In my
realizing that the deputy had been there for a number of years in this second largest VA center in the nation.
Well, candidly, Congressman, there are a lot of inputs that go into these very difficult decisions about picking our leaders in the organization. And after I consulted with Mr. Jones on this, we came to the determination that we did. That is not a disparagement at all of anybody else who wanted that job. And what I'm committed to doing is making sure that we are meeting the mission on behalf of veterans in every performance indicator we can in the Dallas VA.
But understand, the deputy was not considered as far as anyone knows. So I think that you have some work to do to regain the trust of the stakeholders and the veterans in the Metroplex area, in the North Texas area. And with that, I'd like to move to a different issue. Mr. Quinn, in 2021, the VA IG reported that NCA could better ensure that VA grant-funded state veterans cemeteries were maintained according to National Shrine standards. How has the NCA improved the oversight of state veteran cemeteries?
Congressman, thanks for the question. I'll make sure I have a voice through this hearing. But we have looked very closely at that state in particular that was mentioned in the IG report. We've gone back for additional assistance visits with that state, and we have done an additional inspection. That with all states. So we want to make sure that this partnership between the federal government and the state, tribal, territorial, grant-funded cemeteries are out there, that we maintain National Shrine standards. The veterans deserve that, the family members deserve that, and we'll take every step necessary to make sure that those are national shrines.
So you're assuring me that it's meeting the traditional National Shrine standards today?
Congressman, we are still working with that state to ensure that they meet National Shrine standards. Yes, sir.
Thank you.
Yes, sir.
I yield back, Chairman.
Thank you. Mr. Merman.
Thank you, Chairman Boss. This week I'm introducing the VHA Leadership Transformation Act, a bill I believe will help address some of the leadership and governance challenges that are described in the Inspector General Missel's and Comptroller General's DeHadro's testimony. First, my bill will establish a 5-year term for the Undersecretary for Health in order to provide greater leadership, stability, continuity within the Veterans Health Administration. Second, my bill will remove existing statutory limitations on the number of assistant undersecretaries for health that VHA can have, as well as the requirement that nearly all of them be doctors. This will give VA greater flexibility to determine its organizational structure and expand the pool of healthcare executives who can be considered for these senior leadership positions. Mr. Missel and Mr. DeHadro, what are your thoughts on the idea of depoliticizing the appointment of the Undersecretary for Health, and what would be the potential benefits of greater leadership stability and continuity at VHA? And thirdly, and could VHA benefit from having greater flexibility to design its organizational structure?
First, I think there are tremendous benefits to be gained of sustained leadership and stability over a period of time, provided it's the right person in the leadership job. In fact, the criteria that we have for getting off GAO's high-risk list, the very first criteria is sustained leadership, and that's pivotal. Without that, you're not going to make progress. There are a number of other positions across government with 5-year terms. The IRS Commissioner within the Treasury Department, the FAA Administrator between and the Department of Transportation, Social Security Administration has a 5-year term. Unfortunately, 2 of those, all 3 are vacant right now, so they're trying to be filled. But I believe that with the right person, sustained leadership is important, particularly at VA, where if you want to have change of the magnitude that's needed there, you need to have stability over time to guide it to a successful conclusion. I also think it's important to consider people who have management skills as well as medical skills in order to effectuate the type of change that's needed over at VHA. And I would submit to you, although you didn't ask me, that the same thing should be true for VBA and the Benefits Administration, to have that stable leadership over a period of time when you have such important functions that we have, and these are functions that need to be performed. And to be successful, you need to have continuity over time.
And I would just add, second what Mr. Dodaro said about leadership. Effective leadership is and stable leadership is so critical, particularly for an organization as large, complex, and decentralized as VHA. I've been the IG for a little more than 6.5 years. In my time at VA, there have been 6 people who have sat in the undersecretary's chair at VHA, either on an acting basis or as a Senate-confirmed position. So I know that the Commission on Care in 2016 recommended 5-year terms for the VHA. I think they called it the executive director, with the possibility of being renominated for it. So I agree with Mr. Dodaro that anything that gets stability within these very important positions would be very helpful.
And then, Dr. Ellen Harrell, do you have any views to add, and do you think by making the statute less restrictive, VHA could recruit the kind of senior healthcare executives it needs?
Yeah, yes. I think you, oh, I'm sorry, was it to me or?
To the doc.
Okay, I'm
Thank
sorry.
you.
No problem.
I'm sorry. I'm glad we agree. I'm just going to direct all my questions to you.
I'm sorry.
Thank you, sir, very much.
Thank you, Congressman. We're of course, as we do with proposed legislation, analyzing the implications of such a bill. We haven't had a chance to come to a position yet as an agency or administration. I would just concur in principle with my colleagues that continuous leadership is really important. I'm very focused, for example, on filling our medical center directors and VISN directors with permanent folks and making sure we utilize every single PACT Act authority and hiring authority and retention authority that we have to sustain that leadership. I'm very sensitive to the oversight of my colleagues, the colleagues to my right, in various reports about the risks of continuously transitioning leadership. It's hard to sustain initiatives. It's hard to hold folks accountable. And it really sets a path for continuous improvement that's consistent with our high reliability effort to have continuous leadership.
And with that, I yield back my time. I thank you very much.
Dr. Murphy, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Gentlemen, thank you for coming today. I represent North Carolina's 3rd Congressional District. 1/7 of my constituents are veterans or active duty military. So it is a heavily populated military district, and our veterans issues are very, very important to me. I've also been a physician for 30 years plus now, and so the trials and tribulations that go on in the VA are not lost on me. And to your point of stability, trying to fill doctors in, I get it, because we, in the civilian world, are facing a cataclysmic fall in physicians, even more so with surgeons. And I know sometimes recruiting is very difficult in rural areas, and especially in VA areas, and any help that we can do in that regard, you have to let us know, because that's for our veterans. They signed on the dotted line to serve and sacrifice for us, and as far as I'm concerned, the day they come home is the time for us to turn our attention on the second part of that contract. Veteran suicide is a big problem. And Dr. Nowell, I wish you could speak to that and what improvements, where you see this going, because we're at now, 22, 24 a day? Absolutely unacceptable. And what are we doing? What are we doing in the VA to change that? And how can we help, or what fires do we need to light to make a difference?
Well, Congressman, I share your priority around preventing veteran suicide. It is my top clinical priority for the healthcare system, and it's been so for the agency for years. We will simply not be satisfied until we bring that number to 0. Every veteran suicide is a tragedy. We're focused with a comprehensive crisis line and urgent care through our emergency settings to lethal means safety, to ensuring same-day access to care and continuous mental health care, and very importantly, community-based organizations need to be our partners in this, to include, of course, our Veteran Service Org, $20 million in funding to innovative organizations, startups, community-based organizations alike through our Mission Daybreak program, and we're simply not going to stop until we get to zero.
I thank you. I appreciate that. That said, we're not bending the needle. We're not changing things. And I appreciate the work. It's a hard nut to crack. I'm not belaying that whatsoever. Especially in today's society when you wake up and you don't know who you are, whatever you pick these days, and there's so much pressure by society to be something different. I get it, and no wonder suicide rate is up actually across all age groups, primarily with young girls. But that's a different issue. I will tell you this, and I need your help with this, and I need your opinion on this. As a surgeon, I've worked with wound care for over 30 years. Wounds that will not heal, I have found absolute and repeatable success with hyperbaric oxygen. And I will tell you, I've studied the literature. It is somewhat controversial, I will readily admit, being an objective scientist. But I will tell you, I've known several veterans who I know who have undergone hyperbaric oxygen at their last thread, and it has saved their life. So I want your opinion, and I really want a commitment that the VA is going to really put some effort into this. For a last thread, if we're going to really do everything, if we're not going to leave anything on the table, we have to explore this option.
The first thing I'll say is I fully respect your perspective, Congressman, as a surgeon and a physician yourself, and appreciate that you've seen the benefits of this yourself. We do allow for referrals for hyperbaric oxygen therapy in the community. That is a patient-by-patient, physician-by-physician, or provider determination at the point of care.
Does the VA pay for this?
Yes, the VA does pay for that therapy in the community if the referral is made at the front line and a clinical determination is made.
Okay, that's news to me because that's not the word that I'm getting back. So I will take you for what you said, and that's in the record. Mr. Chairman, I'm done. Thank you all for what you do for our veterans. It's critical. I just say this: we don't go to bed without something worrying about what the next thing is, and I expect you guys to not go to bed every night not worrying about that next veteran. So, thank you, sir. I'll yield back.
Ms. Ramirez, you are recognized for 5 minutes.
Thank you, Chairman. Before I went into the state legislature, for a very long time, I was the executive director of a social service agency. We worked primarily with people experiencing homelessness. Many of them were men experiencing homelessness, and about 20% of them were veterans. And so being in this committee is first an honor and a privilege, and certainly there's a lot of work to be done as we talk about housing security and the connections between mental health and housing insecurity. Mr. Frew, as we've thought about access to permanent, all VA fee panel appraisals and all lenders, staff appraisal reviewers take training on appraisal bias, fair housing, and fair lending. Can you tell me how can you tell me if the VA has already removed any appraisers under its newly enhanced oversight process for detecting bias and discrimination?
Well, first, I would say thank you so much for focusing on housing and housing America's most vulnerable population. You know, from our perspective, every veteran deserves access to their benefits, not some veterans. And we want to make sure we root out discrimination wherever it is. From the loan guarantee program and the new focus on finding bias in appraisals, I don't think that it's yet identified bias. I think it's a new program that's still being implemented. So be happy to talk with your staff and you about this as we go forward with it, but I don't yet have any results from that work.
So you're still in the process of putting together the program and the training itself, is that correct?
I believe so, but I know it's in its infancy.
Okay, so for the record, I would like to be able to work with you and closely learn how the training program is being designed and then how we're going to be enforcing it. I think the last thing I would say is, I started as a caseworker, actually as a mail lady, when I worked at this social service agency. I started at the age of 17. And I remember I was a senior in high school, and I'd run right after school to the shelter to help distribute mail to people that didn't have a permanent mailing address. And as young, as naive as I was, I sat in a room and I heard people who have dedicated their life, who died in service, who nearly died in service, talk to me about the trauma that they had experienced, trauma that I couldn't connect with. And I kept asking myself, how could you have fought for our country and now be in a church basement with no access to supports? And so I'd say to you that I've been honored to work on some of the affordable housing initiatives on veteran housing in the state of Illinois, but I really want to put on record how incredibly important it is, as you have said, that we continue to prioritize housing. As we see the housing crisis across this country, veterans, both women and men, are struggling between paying for their rent and paying, in some cases, for their utility bills or rising costs of other things. I'm grateful that the healthcare system within the VA continues to improve, but we still have a long way to go. And so I just want to make sure that as we talk about mental health, as we talk about trauma, that we understand that there's an intersection between housing, employment, supports for family, and that we continue to work to make housing a top priority for veterans. So I look forward to working with all of you to make that happen. Thank you, and I yield back, Chairman.
Thank you. Ms. Brzezinski, you are recognized for 5 minutes.
Thank you, Mr. Chairman. Good afternoon. My name is Nikki Budzinski. I have the honor and privilege of representing Illinois' 13th Congressional District, which is in central and southern Illinois, a little further south of Congresswoman Ramirez. I have 2 VA clinics, one in Decatur, one in Springfield, that I have the honor of getting to work with and represent. I also have a lot of constituents that are serviced by a VA hospital in St. Louis, as the district is quite long and reaches over there. I am really excited. I'm the granddaughter of 2 World War II veterans to get to serve on the Veterans Affairs Committee and help my constituents, including many of those that are servicemen and women. As a new member and as a part of the Veterans Affairs Health Subcommittee, I look forward to helping to ensure our veterans have access to the highest quality and affordable health care. This includes, for me, really prioritizing issues around expanding access to telehealth, supporting and helping to recruit the workforce of the VA. I know a number of members have spoken to shortages and looking at how I can be helpful in that area, and ensuring that Americans have, our veterans, have access to behavioral health services, something that I know a number of other members on the committee have also spoken to. And because my district is predominantly rural, as you know, there are a lot of specific challenges that rural communities face when trying to tackle some of these priorities. So I believe our veterans have sacrificed so much for our country, and it is our duty as a member, as members of Congress, to work together to find the best solutions. And another point I'd make is I'm honored to serve on this committee, which has a long history of bipartisan working together to service our men and women that are veterans. And so I'm committed to working with my colleagues to do just that. And so I just want to say a thank you to all of you for being a part of this panel. This was very informative, and I'm sorry with our schedules that we have to kind of come back and forth in and out of our committee hearing. But I did want to ask specifically to Dr. Elnathan, with the ongoing work of the PACT Act, which is, I think, very exciting for our veterans in this country, I'm very specifically interested in how specialized care can be expanded through the work of the implementation of the PACT Act. And then as a second part of that same kind of question around the PACT Act is how you're looking at the unique challenges that implementation in rural communities, how you're going to be tackling those.
Well, thank you, Congresswoman. We share your dedication, of course, to providing the highest quality, best care we can, including to rural veterans. And so I think the most enabling thing we have to do to fully implement the PACT Act to its fullest extent is to hire enough talented, quality providers to be able to do so. And so the PACT Act actually affords us the requirement, frankly, to do a study on making sure we maximize all of the tools we have to be able to recruit specific staff to be able to meet the needs of rural veterans. So we've already commenced with that important work. We are, of course, also trying to maximize, as you mentioned, the use of telehealth because that just makes care more accessible, especially to rural veterans. We have a partnership with the Federal Communications Commission, the FCC, to be able to extend wireless and broadband access. We're handing out tablets as well and devices for folks in rural areas to be able to receive that care. And we're making sure they're trained to be able to do so, including training and supporting caregivers. So across the spectrum, hiring the number of providers we need to hire, making sure we're as productive as we can be with our clinics, with various initiatives to be able to improve productivity, but also extending connectivity and telehealth to meet rural veterans' needs.
Thank you. Mr. Chairman, I'll yield back my time. Thank you.
Thank you. That concludes all of the people who are having questions. Ranking Member Takano, do you have closing remarks?
Yes, just briefly, Mr. Chairman, thank you for putting this hearing together and calling all the witnesses. I want to extend my deep sympathy and condolences to Representative Van Orden for the tragic loss of, it was your brother. Unfortunately, this event occurred at a time when VA had not implemented the recent Compact Act. I want to use this opportunity because I think we might want to get this message out to folks that the Compact Act was implemented on January 17th of this year. It was a bill that I introduced and carried. I'm very proud of it. And what that bill does is it says that a veteran can call 988, the crisis hotline, and be evaluated and be immediately referred to a mental health practitioner. It could be inpatient or outpatient, and it could be in VA or out of VA, whatever's the pathway. And involved making sure our veterans know about it. And since I took over the chairmanship in 2017, suicide prevention has been my #1 priority. So I want to thank you. So many of the new members of Congress coming in, new people coming onto the committee have made it their top priority. So, and I agree with Dr. Ellenhall, we will not rest until that number is 0. So thank you.
I want to thank the ranking member for bringing that up because it is vitally important that all of our members know and understand what that is, that the outreach can be quick and that no one would be denied. And I do want to thank all of our witnesses for being here today, and I think it's clear that the VA has a lot of work to do, but we can get VA to where it needs to be by going back to the basics and conducting thorough oversight of VA. And where fixes are needed to be made, we will work hard and can enact thoughtful, necessary legislation that puts veterans first and fiscally responsible. We will propel VA into the future, force it to keep pace with the modern healthcare systems for this generation of veterans and the next. Our veterans deserve no less than that, but the best in exchange for their service. And the VA they use day in and day out should reflect that. I look forward to working with the honorable members of this committee and our stakeholders to accomplish these objectives. And again, I want to thank you for being here today. Now, I ask unanimous consent that all members shall have 5 legislative days in which to revise and extend their remarks and include extraneous material. Hearing no objections, so ordered. With that, we're adjourned.